Welcome. We're here today, Tuesday, September 30th, 2025. It is a little bit past 5 p.m. and we're at the Caldwell County Department of Social Services Board Meeting. We'll take a moment to welcome everybody and welcome the people who are watching. We'll start off with our Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Next, we'll have an invocation by Dr. R. Victor Gray from Outcast Community Church in Lenoir. Welcome.
Can I move that microphone towards me?
Yes,
all right,
absolutely.
Let's get that down. Ladies, forgive me for not standing. I want to thank you all for the opportunity to be here and lead this invocation. Outcast is a place for everyone, and we're doing everything we can as a new baby church that meets in West Lenoir Elementary School to serve our community with absolutely no strings attached. So let's pray together. Father, I thank you so much for the opportunity to be here this evening with these incredible people who have dedicated their lives to the service of those who are the least privileged and the most needy among us. In my mind, it's nothing short of being Christ-like. I pray that you would grant them the wisdom needed to make the most of what we have for those people who need it. Lord God, I pray that you would continue the great work that these people do. All of this, I ask in your holy name. Amen.
Amen.
Thank you.
Thank you, Dr. Gray. You're more than welcome to stay if you want to. All right, next on our agenda, we have the swearing in of board members by Abby Rich. We have a reappointment from Ms. Tracey Irvine, who's beside me.
Okay, we'll make it easy. All right, if you will place your left hand on the Bible, raise your right hand. Do you, Tracey Irvine, solemnly swear that you will support and maintain the Constitution and laws of the United States, that you will be faithful and bear true allegiance to the state of North Carolina and to the constitutional powers and authorities which are or may be established for the government thereof, and that you will endeavor to support, maintain, and defend the Constitution of said state, not inconsistent with the Constitution of the United States? Okay. Do you, Tracey Irvine, further swear that you will execute the duties of the office of member of the Caldwell County Department of Social Services Board to the best of your will and ability according to law, so help you God? Okay, congratulations. And then if you will, there's 3 copies here for you. Congratulations.
Welcome back, Tracey. Next up, Mr. Christopher Bumgarner. Glad to have you. Welcome to the team.
Are you okay with just saying I do? I think I do. Okay. All right. If you will place your left hand on the Bible and raise your right hand. Do you, Christopher Bumgarner, solemnly swear that you will support and maintain the Constitution and laws of the United States, that you will be faithful and bear true allegiance to the state of North Carolina and to the constitutional powers and authorities which are or may be established for the government thereof, and that you will endeavor to support, maintain, and defend the Constitution of said state, not inconsistent with the Constitution of the United States? Okay. Do you, Chris Bumgarner, further swear that you will execute the duties of the office of member of the Caldwell County Department of Social Services Board to the best of your will and ability according to law, so help you God? Okay, congratulations.
You can take your seat.
Welcome, Chris. All right, next up on our agenda, are there any amendments from the board or director?
No amendments.
All right, can I get a motion to approve?
I'll make the motion.
Second.
Everybody in agreement, say aye.
Aye.
All right, next up, approval of the last meeting's minutes. Can I get a motion to approve?
I'll make a motion to approve the minutes of the previous meeting.
Second.
Everybody in agreement? Aye. All right, Miss Laura Harrison, we have the Employee of the Month recognition.
This is really close. Well, so I'm Laura Harrison, I'm the Deputy Director at DSS, and this is Kim Arnett, the Director. And she is our Employee of the Month for last month. And I know, I'm not sure if you guys saw it or not. Obviously, Chris, I don't think that you did, but I know Donnie did, so I'm going to read her nomination. This person has the qualities of a true leader. This person pushes us as an agency to be and do better for ourselves and for the community we serve. This person thinks outside of the box to look for ways to advocate for the employees of this department. Since being in the role as director, she has advocated for employees for pay and other benefits when no other director, board member, or commissioner has done so. She has stood her ground when decisions get tough and does not back down. She keeps a positive attitude and truly cares about employees and wants them to grow in their career. She has transformed the management team to leadership team, where we learn and practice ways to be better leaders and help staff grow. Even though sometimes we all have grown because of it. And I didn't realize that was so. Our department is not stagnant and is moving forward with new initiatives. This person is open to new ideas and processes. She challenges the status quo. She consistently goes above and beyond in supporting staff and the mission of our agency. One of the most admirable qualities that she brings to the leadership role is no matter how full her schedule may be, she always makes time to listen, offer guidance, and help problem solve. Her open-door policy and approachable leadership style create an environment where staff feel supported and valued. Whether it offers a listening ear, helping navigate complex situations, or simply being present during challenging moments, she leads with both wisdom and compassion. She works collaboratively with the department leaders to find thoughtful, long-term solutions that benefit both staff and the individuals we serve. Her ability to see the big picture while also caring deeply about the day-to-day operations truly sets her apart. Because of these things and so many more, we nominate Kim Arnett as Employee of the Month.
Thank you for all you do, Kim.
So I'll just say that was very unexpected and very appreciated. I think that the reflection of any director is their staff. And so we have a wonderful staff, and I couldn't do my job if we didn't have those individuals. And a lot of them are sitting here, our supervisors and our managers and our deputy director. So I'm thankful to have who we have, and the citizens of Caldwell County are lucky to have who they have working for them. So thank you, thank you.
Well deserved.
Well deserved. Kim, thank you for all you do. All right, next up on the agenda, we have an introduction of new administrative assistant. I'm gonna try to get it right. Ashlyn Negrete.
So Ashlyn came to us the beginning of September, which feels like she's been there for a lot longer. She actually is from California, but she has been here for how many years? 4 years. So she's enjoying Caldwell County, and she's come to us actually from the banking industry and some other kind of customer service things that she's done, and she's done a fantastic job. She's fit in well, I think, with our admin team. She's learning very quickly, and so we're very excited to have her. I'm grateful that she's with us.
Welcome aboard.
Thank you, appreciate it.
All right, next on the agenda, we have reports. It looks like item A is Medicaid presentation by the Medicaid supervisors.
Yes, I couldn't remember the order of the slides. So I'm Dawn Williams. I'm one of the Family and Children's Medicaid supervisors.
And I'm Jennifer Ansley. I'm one of the other Family and Children's Medicaid supervisors.
And we're missing Sabrina Fodder, the third Family and Children's Medicaid supervisor. We push, is it these?
Go, the keyboard's under there on the shelf. Just pick it up, it's on, yeah. You can put it on the top.
Oh, thanks,
There
Laura.
you go. There you go.
It's also upside down, so,
Hit the keyboard, the space bar.
oh, it was off.
There you go.
Thank you. Family and Children's Medicaid. Family and Children's Medicaid, what is it? A health insurance program that serves low-income individuals and families who cannot afford health care costs. How do I qualify for Family and Children's Medicaid? While overall Family and Children's Medicaid is an income-based program, each program code has their own eligibility requirements.
We offer a variety of programs for children, birth, all the way to adults, age 64. These are all our full Medicaid programs. We offer pregnant women Medicaid. We also have breast and cervical cancer Medicaid, and we have foster care and adoption Medicaid for children.
And deductible Medicaid.
Yeah. And then our program that anyone that is not eligible for full Medicaid, if they meet the income requirements, is family planning. And it just covers all necessary family planning, birth control, anything of that nature.
Questions?
Very simplified.
Very simple.
It is a very complex program.
Yes.
But very,
It's very simple.
Constantly changing.
We just give everybody Medicaid that we can. Everybody that qualifies.
yes, everybody that qualifies.
Okay.
Thank you, guys.
Thank you.
Next up, we have staff development presentation.
Well, we're going to do adult Medicaid.
Oh.
So there's a couple different areas of Medicaid.
Okay.
So family and children's, and then they're going to do the adult Medicaid.
Welcome.
My name's Carrie Williamson, and I'm the adult Medicaid supervisor for private living arrangement clients. And I guess we're hitting that button, yeah. So with our program, it is income and resource-based. So with us, we're looking at for aged, blind, or disabled clients more than anything. So our aged clients would be 65 years or older, and then we have clients who are blind as well. And then our MAD program, which is medical assistance for the disabled. So they can be adults who are disabled and working. Anybody that's age 65, as I mentioned before, and then any clients who are deemed disabled by Social Security Administration as well. We do have an MQB program. Both of those those three MQB programs, they take care of clients who have Medicare. So that helps with any Medicare Part B premium to be paid by Medicaid. So there again is our list for aged, disabled, blind, and then those MQB programs. We look at income, resources, and some of those resources can be their property, bank accounts, 401ks, IRAs, annuities, life insurance, vehicles, boats, things like that. And then some of the things that we may ask for are their ID. Sometimes we ask for their Social Security card, copies of their insurance cards if they have any other insurance, bank statements, wages, life insurance policies, things like that. And then there you'll see some of our income and resource limits. So the income limits for individuals as well as couples. Any questions?
Great information. Thank you, guys.
Welcome. And this is Angela Clark, and she'll take over.
Thank you. So I'm Angela Clark. I do long-term care, CAP, PACE, special assistance in-home, and transportation. Those are my programs. CAP is Community Alternative Programs. PACE is Program for the All-Inclusive Care of the Elderly. Special assistance is those that are in assisted living facilities or those that still need that special assistance care at home, so they can still have that care at home. Income limits vary based on programs. It is all changed. Long-term care is those that are in a skilled facility. That income limit varies based on facility that you're in. So that income limit is different between facilities. Cap and PACE is that as the income limit for the PLA arrangement that Carrie had for her program. Special assistance, that income limit varies based on need. If you have Alzheimer's or dementia diagnosis, that income limit is going to be a little bit higher. Resources are still the same as what PLA uses. We still have that same resources we look at. Our income limit is capped at $2,000 unless there's a spouse at home, then spousal protection comes into play, and that's a whole different ballgame. Any questions?
For these programs, how do we get these out to the public? Do they need to come to the facility? Is it online? For what's offered?
How do they apply?
How do they apply?
Yeah, how do they apply, or how do they get information about how to apply?
It depends on, for my programs, are all Medicaid in general.
All Medicaid in general?
They can apply online through ePass, they can fax it in, they can telephone, they can come in person, they can mail. There's multiple different ways that we will accept an application. You can have an authorized rep. The power of attorney can come in and do it as long as the paperwork is on file. You can have the actual power of attorney paperwork with you, so the actual client does not have to do it.
I just thought maybe the public might want to know.
So there's multiple ways. You can go through the marketplace. That's another way to apply as well.
Thank you.
And if they have any questions, if anyone has any questions about how to apply, they can call the office, 828-426-8200, and ask. And so they can get direction on, they can talk with someone in those programs, or they can just ask a general question about where to go or how to apply.
Yes.
Thank you so much.
Thank you.
All right, got monthly updates. And next item is our financial report from Chris Conley.
We have staff development.
Oh, sorry. I'm sorry, guys. I'm sorry. Staff development presentation.
We didn't want to.
It's all bundled in right there.
We didn't want to
Yeah. We want to hear from you, Chastity. We really do.
So I'm Chastity Jones, and I'm the Staff Development Supervisor for Economic Services. And I'll give you a little bit about what my team does. Oh, I'm sorry. I don't know why I'm thinking somebody's going to do it for me. So this is my team, and so I have 7 employees. 2 of my employees are with F&S program or food and nutrition program, and their additional program is Work First. I have 3 family and children's Medicaid workers, and their additional programs that they help with are energy assistance as well as child care. And then I have 2 that is adult Medicaid and long-term care. So that's my team. So what our goal is as staff development is we try to provide a foundation through detailed one-on-one training with new employees to so that they will have success in their position, hopefully. That's our goal. And to be able to monitor them as well, to prevent errors, things like that, with audits with the state and, that kind of thing. So, and these programs are ever-changing, policies ever-changing. So my staff are responsible to keep up with that policy so that we can keep the employees informed as well as doing the training. So my other thing that I do is I'm the one that helps recruit people for economic services. So that can be challenging from time to time, but our goal is to try to tell people that these jobs are not just cushy office positions, but they are like production kind of positions, because it's a lot of volume when you're talking about Medicaid, food, nutrition, things like that. There's a lot of volume that come through. So when I interview these clients, these potential employees, I talk about that. I try to stress that so that they're not, when they come in, they're not surprised about that as well. So that is one of my, I tell them kind of that it's a calling, which I do feel like it is a calling. You've got to really want to do this kind of position and feel like it's a calling in order to be able to be successful with it, not just a job. So what my staff does is they train new employees. That's probably their most important duty. So it's mainly eligibility workers. Most of the employees we hire are income maintenance caseworkers, and we do that for, all the different programs. Mainly what my staff train are food and nutrition and Medicaid programs. We try to start on day one with these employees doing one-on-one with policy training as well as procedure training. We have these employees kind of under our training for at least 9 months, sometimes up to a year, just depends on their progress. During that time, we review their work. We make sure they're doing things correctly. During that time, we've also, since we started in February of 2023, actually doing the training. Prior to that, lead workers on teams did training. But since that time in 2023, we've had a lot of bumps in the road. We found things that work. We found things that don't work. Some of the things we've implemented are everything from policy guides to daily progress logs that we could keep up with the trainees' progress. And then also we have meetings with supervisors just to kind of stay ahead of any potential problems in the early parts of that training process. So the other thing they do is they complete second-party reviews for seasoned caseworkers. So the state and federal require so many second parties to be completed each month. So that is another thing my team does is they actually complete those second parties for the seasoned workers. That way it's kind of like trainees. You're also addressing any kind of errors, things like that you're finding. It could be just for individuals, or it could be something that that we find the whole team is doing incorrectly.
And are those just randomly selected?
Yes, those are randomly selected. Now, for F&S program, we do have to do 5+ households is a requirement, so we have to do any households that's 5+. But for the Medicaid programs, it is more randomly selected. And then the other thing we do is audits. So every program has audits that they have to go through. My team is responsible to kind of check audit cases, coordinate with caseworkers and supervisors just to make sure that those corrections are happening on those audits, and then implement training, things like that, just to hopefully to prevent future errors. We are going through a RETA audit right now for Medicaid, and so we coordinate with the auditors and my staff and the supervisors just to try to rebut any errors that they find, if we can, through policy and things like that. So that's kind of the gist on the audits. Any questions?
Sounds like you have a job.
It is a
Busy
job.
job.
I will have to say, this staff development is a fairly new program that we have at the department, and I'm proud of the staff development program we have. I mean, and I think it's a pretty robust program, and the training for the new employees, along with, just helping with seasoned employees. I mean, it's something that some counties are envious of, and so we're proud of the program we have in economic services and child welfare, and we're expanding in child welfare this year because we've gotten a permanency staff development person. So we're excited about our staff development program. And Chastity and her team do a great job.
Thank you, Chastity. Now, on to the monthly updates, correct?
Now it's Chris.
All right, Chris, hop up here. What you got for us? Good news?
Oh, a bunch of numbers.
I thought you were going to say a bunch of nothing.
Good evening and welcome to our new board member. I'll go a little slower than normal for your benefit and maybe explain things in more detail than I normally would. Our financial report, actually like most of our monthly update reports, it contains numbers for the past 3 months. So we just kind of have a running comparison there for you to look at each month. I highlight the numbers that I typically discuss in this meeting. The top section of the report is our expenses for each of the past 3 months. August came in at just under $1,350,000. The section below that in the middle of the paper, revenues for the past 3 months. And for DSS, we typically use the term revenue. However, it's interchangeable with the term reimbursement because we're not selling any product. We're not, a company making revenue that way. It's mostly reimbursements. And the biggest expense of our department, if you look back up at the expenses, is actually staff cost and operational expenses, administrative cost, so to speak. Therefore, our biggest revenue or reimbursement is for those actual administrative expenses. And that comes through our monthly 1571 revenue reimbursement report. So again, expenses and revenue, the biggest driver of that are our administrative expenses. Foster care, room and board payments are the largest service that those dollars actually flow through our budget. Services such as Medicaid and food and nutrition, those service dollars are not a part of our county budget. Looking again at our revenues, the way it's supposed to work is we incur the expense 1 month, we submit it for reimbursement the following month, and before that following month ends, the state is supposed to reimburse us for those expenses. Our state does not do that timely. Therefore, you will often hear me say we're a month behind on our revenues, and that's why the state simply didn't send that money out to counties. And I have zero faith that they will do so on a timely basis as they committed to in 2013 or 2014. But that's neither here nor there. So in July, when we're working to close out the prior year budget, and we're running a month behind on reimbursements. In July, we typically receive reimbursements for May and June services. And that's what occurred this year, as is typical. So July reimbursements were really high at almost $2 million. We dropped down to $164,000 almost for August. That is simply a product of July expenses that were to be reimbursed in August were not reimbursed. So that's the reason for the huge fluctuation between the 2 months. So with, again, the low reimbursement total for August, our county dollar came in at almost $1.2 million for August. And the bottom section of the report is simply a comparison of current year to prior year, same point in time. So far, for the first 2 months of the year, expenses are up $94,000, revenues are up almost $43,000, so our county dollar is up $51,000. And that's more or less directly related to increased staff cost is the biggest driver of that compared to where we were same time last year. And that's not simply salary. The county increased the county portion for insurance contributions by $80 per employee per month. Well, that's about 14 grand per month, so 28 grand of that expense increase is to cover the roughly 170 positions that were filled. Actually, they made that they made the contribution for every position, whether filled or not, so that amount would actually be a little higher. But anyways, just want to say, yeah, it is mostly related to staff costs, but not simply fully related or due to increased salary cost. If you have any questions, I'll be happy to try to answer them.
No questions on my end. Unless you guys have any?
All right,
Thank you, Chris.
Thanks, Chris.
All right, next up, we got the director's report from Ms. Kim Arnett.
Okay, so let's first look at the personnel report in your package. Let's see. Well, do you have a copy of the personnel report?
The vacant positions. Yeah.
So, as you can see, we have filled quite a few positions since last month. And so that has been, we've been very successful with that. It's been a lot of work, a lot of folks have participated in that hiring process, and so excited about that. Just a couple positions that came vacant, and I think one of those positions was because of some moves within the agency. So I feel like we're trending in the right direction. So we hope that continues. A couple other things that I want to point out this evening. I want to talk about our fentanyl task force. We started that a couple months ago. We had our first meeting, I think, last month, and the second meeting just last week, maybe. Our second meeting wasn't quite as robust as our first meeting, and that is typically the way things happen, but we're hoping to, get more involvement as we move forward. One of the things that we identified as far as not necessarily a gap in service, but a gap in, I think, educational outreach to new parents or to parents in general or to the public is environmental exposure or accidental ingestion of fentanyl. And so that's one area that we really want to focus on. Some of the folks from the hospital, from UNC Blue Ridge, they were talking about the education they provide to new parents, and that is not anything that they talk about. And so for us, with child welfare, that's what we see mostly when we're talking about children being exposed is environmental exposure and accidental ingestion. Now, of course, we have issues with prenatal exposure. We don't necessarily get involved with that until a child is born and there's safety concerns in that home after the birth of the child. So after the birth of the child, the bigger issue is that environmental exposure. And so the health department is going to be working with us and trying to find some information about that and trying to get that out to the public about what, how dangerous that is and what little amounts can cause such traumatic impact. So that's where we are with that task force. There's also HB 612, the Fostering Care Act, or North Carolina Act, Fostering Care in North Carolina Act, sorry, I can't get that out. Within that act, there is now a requirement as of tomorrow to fingerprint all city and county employees who are going to be working with children in any capacity. So what that means is, according to the School of Government, if a person's, one of their primary duties involves interacting with children, they are going to have to submit to an SBI fingerprint check. Now, this is not something that we've done in the past, so this is new for us, and we all are definitely in favor of this and think it's a great idea and should probably have been being done. However, it is going to delay our hiring process, we fear. We don't know what the turnaround will be for those fingerprint checks, and so we can't hire someone until they come back. And so obviously, the offer is conditional on those background checks. So, if a background check comes back and we find results that are not favorable, then we're going to have to rescind that offer, and so they can't start until that check has been cleared. So that'll start tomorrow. Any offer that we make and is accepted after or tomorrow and moving forward. That does not apply retroactively. So for our employees that are currently there, we do not have to go back and have every one of them SBI fingerprinted. However, if we have an employee who moves to a different position, who makes application to move to a different position within the agency, they will have to be fingerprint checked. And we're trying to get some more concrete information on how long those checks last. And if, let's say, we have a new employee who we hire tomorrow and they work for a year and then want to move to a different position and they make application and get hired in that new position, how long is that fingerprint check good for? Do we have to do it within a year? Is it 5 years? So we still are seeking some clarification on that. Also, we are looking at, as a state, through the Fiscal Research Division, we are putting together a survey for counties to look at staffing and workload that will be a result of some of the new legislation as far as Medicaid work requirements and some of the more frequent recertifications. And so they're putting out a survey for all counties to participate in, and they've reached out to a couple directors for the directors to look at that and give some feedback. So I did that last week, and along with several other directors. So I'm hoping that survey comes out in the next month or so, and so that the state can look at what our workforce looks like and what that workload may be. I think that is all I have. Do you guys have any questions about anything that I've talked about so far?
None on my end.
Okay.
Thank you, Kim. Next up, Children's Services by Laura Harrison.
So before I do the normal highlights, sorry, that's really loud. Leah Church is here. She's our lead supervisor in child welfare, and she's going to give some quarterly numbers. I don't know if y'all remember, and Chris, new for you. She's going to come every quarter and just kind of give those numbers and updates. I won't steal her thunder about her charts, so I'll let her speak to that. But so I'll let her do hers, and then I'll go into the normal.
Welcome, Leah.
Hi, good evening. So I'll go ahead and get started. So the totals for quarter two for reporter information, our top three reporters in April were educational, law enforcement, and mental health. May was educational, law enforcement, and medical, and then June was law enforcement, medical, and non-relative reporters. And so we've been tracking that. I'll talk more next month. I'll be back to talk about quarter three. Sure. So we've had some policy changes recently with us entering a path, our new child welfare system, where we're going to be working all our cases. And so that policy's changed, and so our report numbers are going to increase, and we're hoping it's not going to be significant, but there's been some changes where new information we received during a case, we could just go out and deal with it. Now a report's got to be made and we deal with it. And so it's going to change the way our reporter data is captured. And because of PATH, we do have really awesome charts that I have access to for intake. And so I'll be able to get those to you guys moving forward. It's pie charts and explains a lot more. So do you guys have any questions about that?
I appreciate you getting the information back to us.
Yeah, thank you.
Okay, so in your packet, you should have the report. I'm not sure if it'll be shown on the TV or not, so I'll read it. So in August, as you'll see, we had 154 intakes. 78 of those were accepted, screened in for assessments. We had 21 assists. 20 cases were open for in-home services, or they were active. We didn't open 20 new. They were active during that month. to assist during that time for in-home. And just some information. So in-home is if we found that services are needed for a family, we feel like the child or children cannot remain safely in the home unless our services can continue. And so sometimes the child may be out of the home, but custody still remains with the parents. But maybe they're in what we call a temporary safety provider placement or something like that. So just to give some clarification on that. We had 140 children in foster care or experiencing foster care. We were able to finalize 3 adoptions, and then we had 18 general foster homes that were licensed with us, and 8 relative kinship-specific homes that are licensed through us for the month of August.
And so when Leah was talking about the top 3 reporters for August, was that these numbers for August? Did
No,
you say
so she
August?
gave April, May, and June. The numbers
And
in.
those will be next time?
Yes.
Okay. I just was curious, because again, we see it, 128 in July, and then one, additional 30 in August.
And so just
I
remember,
assume-
school started in August.
Yep, that's kind of what I was thinking.
Yeah. And so any questions about the numbers, and then I'll just give it a couple of highlights. Okay. So next week, we have a conference happening in Orlando, Florida, that thankfully we're fortunate enough to be able to send 6 employees to that, a supervisor and 5 employees or social workers. And it's for permanency planning staff and adoptions. And so it's the Family Rising Conference. So we're real excited about that. And we try to send people to these conferences when we're able to. We have several recruitment events happening in October, like at fall festivals and things, so for foster homes. So throwing a plug out there if you're at home listening. If you're interested in being a licensed foster parent or helping other licensed foster parents or helping in some way, please give us a call. I don't know Valerie's direct number offhand, but you can call the main number, 828-426-8200, and ask for Valerie Ackerman. She's our licensing social worker, and she'll be happy to assist if anybody has any questions or want to be licensed. And then I just wanted to give an update. Kim talked about it a little bit about, thankfully, we've hired several people recently. And so we've changed our interview process in child welfare some, and it seems to be very successful. And so it seems to, and by successful, I mean being able to move more quickly than we have before. And so we've had several supervisors in child welfare step up and take on different roles during that process, whether that's calling and setting up the interviews or actually being in the interview or calling references. And so we do a telephone interview now with the applicant just to kind of, gauge, are they interested still? Are we interested? Because not everybody knows about child welfare. And so just really giving them a broad overview of what that is. And then after that, if we do an in-person interview, before we do that interview, we really try to go ahead and do reference checks to see if everything's, good to go before we actually bring them in. And then as long as that's good, we bring them in for their face-to-face interview. We have standardized questions both for the telephone interview and the in-person interview. And so by that point, then we're, if it's somebody that we're ready to proceed on, they come and then they staff with Kim, myself, and with Casey as well, the program manager of our permanency planning, so we can move forward at that point. So just wanted to kind of give you an update on that. Do you have any questions about anything?
Thank you.
All right, thank you.
And I'll just say, as far as this interview process goes, this was a process. Oh, that's okay. This was a process that our supervisors came up with, but we in leadership did an activity of kind of breaking the rules, which is challenging the way we're currently doing things instead of just staying stagnant in what we're doing. And we gave them kind of free rein to come up with something that you think needs to change. And so this was a process that they came up with and they implemented, and it's been very successful. So,
And are you guys doing team interviews during that first face-to-face interview?
they do a couple people in those interviews.
So we typically do a couple supervisors, but not like members of a team, but typically 2, maybe 3 supervisors.
Gotcha.
Yeah. And that telephone call is really a screening for them to hear about, what the position entails, but also for us. It gives us an opportunity to ask more general, broad kind of sweeping questions. Also talk about salary, because sometimes that, we've found that when they come in and we've gone through this whole process and we get to the salary point, they're like, okay, I'm sorry, that's not the salary that I can accept. And then we've gone through this whole process that's taken months or not months, but a month at least. And, you know, they're not interested. So it's working well, I think. Nice.
Alrighty. Next up, Family Support Services highlights. Randy Thompson.
So I'll go over the numbers for the month of August. So for food and nutrition services, there was 594 applications submitted. There's 11,151 cases, and the total services paid out was $1,892,347. For child care, there were 6 applications submitted with 451 cases, and it was $226,127 paid out in services. For child care, we are still on a waiting list. For family and children's Medicaid, there was 422 applications submitted, and that's 21,711 individuals currently receiving. Adult Medicaid, there was 121 applications submitted, and that's 8,626 individuals currently receiving. Work First Family Assistance, there was 16 applications submitted, and there's 40 active cases currently. For our child support services, there's 2,453 active cases, and the total services collected was $445,623.07. For emergency assistance, there was 197 applications submitted and 98 telephone calls in regards to the program, and $30,996.51 in services paid out. For customer service, there was 2,142 individuals served at the front desk, and 4,550 calls came through the agency. For our program integrity, we received 12 referrals, and we was able to pursue 7 of those and close 5 of those referrals. In talking about emergency assistance, I'm going to back up a little bit. We are preparing for peak season of emergency assistance. That starts December, which the heaviest month is in January. So we're starting that training and picking our lucky staff members that get to process these applications and working with teams to figure out where their duties are being shifted to during that time. So we're in the process of doing that now. We try to do that pretty much about 2 to 3 months ahead of time just to prepare. Also for program integrity, and that's our fraud department, Kim mentioned last month that we were going to be meeting with the ADA. Me and Kim was able to meet with ADA Mitch Walker, and we had some good conversations about prosecuting some of those cases. It was decided that we were going to prosecute the trafficking cases only at this time, and that's the cases where they're buying and selling their food stamps. So if a card is found, it's being used different places, back to back, different things to that nature goes into that investigation. The ADA is reaching out to law enforcement agencies and explaining this process, and going to set up a meeting with Kim, myself, and them. We're going to set up some times to talk about this and get contact information. Also with that, our program integrity unit and legal has started a new staffing process to staff those cases prior to moving forward with introducing them to the law enforcement, ADA, different things. So we're going to be staffing those with our legal department before going to that step. Any questions? Okay.
Good information.
Thank you.
Thank you, Brandy. All right, adult services. Beverly Ruth.
Okay. Hello. Everybody should have our numbers in their packet. We're pretty much consistent. 46 reports received this month, and we only screened in 18. Guardianship cases are still holding at 47. Special assistance has been stable lately at 49. So it's pretty much self-explanatory. You don't really see a big increase in our numbers. They stay steady. We did have that one increase in July, but we researched and found out why we had that increase, and it was had to do with some changes with the skilled nursing facilities. But I think everybody's got a better understanding, so I think the reports went down this month because of that. Any questions about our numbers? Nope. Okay, highlights. We had our quarterly feeding the unhoused at Yokefellow. We served 105 hot dogs, which most people got to. So it was about 40 people we served. We took Medicaid and food stamp applications. Brandy and Elizabeth were there to do that. The health department also assisted. They provided information regarding in utero drug exposure risks. And then we distributed blankets, socks, toothpaste, and toothbrushes. All of the blankets were gone first thing. So we hope to do another session in December as it gets colder. And we're hoping maybe to do some kind of sleeping bag drive. I think April has talked to a local agency that's going to help us with that so that we can distribute sleeping bags when we do our lunch. We had our first quarterly CQI consult for this year. That's when the state comes in and reviews our records. We received all 4s on everything was reviewed. 4s stand for significant quality, and that's the highest you could get. So thanks to my team. They do a wonderful job. They make me look good. No, I'm just kidding. And then the last thing I was going to talk about is, we've tried to do a lot of collaboration, a lot more collaborate with communities, agencies. We recently had a meeting with RHA, Lenoir PD, regarding a high-risk case that we all had some contact with, some involvement. It was a very good discussion. We discussed the challenges that were faced during this crisis, and also gave us the opportunity to clarify our agency's procedures, statutes, and limitations. Knowing what everybody else can and can't do is so helpful. And I think this collaboration was successful, and I think it will help us moving forward with challenging cases. So, any questions about anything I've gone over? Okay.
Thank you for all you do.
Thank you. I want to say something really quickly before we adjourn. And I knew I was forgetting something because I didn't write it down. And in that, I wanted to mention something very important, which is the potential federal government shutdown. And so there's been a lot of questions about, well, what does that look like for DSS? What does that look like for local governments? And so what I will say is there could be potential delays in some of the funding that we receive for federal programs. And depending on how long it may go, it also may be potential delays in citizens receiving some of the funding and some of the benefits they receive, especially 100% federally funded programs such as SNAP, FNS, and so and other programs with the health department. What complicates this even more for North Carolina is that we also do not have a budget. And so we're right now running on what's called a continuing resolution. And so what that means is that all of the programs we're spending at normal levels. And so whereas in previous years when government shutdowns were potentially going to occur, we could have, as a state, allocated some excess funds to cover some of the gaps in administrative funding for programs or benefit funding. Right now, because we're operating on this continuing resolution, we're unable to allocate excess funding or funding from other programs to fill these gaps. And so that may complicate things. So I just wanted to let you all know that we are watching this as a directors association, and they're keeping us very informed on what that may look like. And so
Is there any conversation with rate reductions? I know that some of us, others are looking at that and how that might impact, I was thinking like foster care or other.
So are you talking about Medicaid? So we did get some information about Medicaid rate reduction as part of those Medicaid cuts that are being made. We aren't sure what that's going to look like for us, of course, for the Medicaid providers, especially, any kind of therapeutic placement, any kind of level 3 PRTFs, those type of therapeutic Medicaid reimbursed placements. It may look like they no longer want to serve the Medicaid population. We don't know, because, the Medicaid rates aren't that high anyway. And so then when you start cutting those rates, it may look like providers pulling out of serving the Medicaid population. We hope not, but that, I would say that is a potential. So I knew I was forgetting something I could think, and so I wanted to mention that.
Yeah, I thought you were going to mention it earlier, but I said, well, maybe
Yeah,
she didn't want to talk about it.
And I should have, and for some reason, it just slipped my mind, and I did not mention it, so.
We would rather pretend that it is not an
Yes,
issue.
absolutely, yes.
Yeah, I was just trying to pretend.
All right, guys, looks like our next board meeting is going to be Tuesday, October 28th, 2025, 5 p.m. in the same spot, out in East Starnes County Office Plaza, here in Lenoir, North Carolina. I want to make a motion to adjourn the meeting.
Make a motion that we adjourn?
Second?
All in favor? Aye. Thank you guys for coming.